What are you, a male supermodel?
Yeah, sure.
Good looking guy, dude.
Thanks,
Good
man.
looking
Appreciate
guy.
it. How about you?
Oh, thank you. So what's going on with your body?
Honestly, the only thing that hurts right now is my elbow. I got a little lingering elbow pain right here. With some tendonitis, stuff like that.
What happened?
Probably working out. Probably doing too much. Neutral grip pull-ups, I think. You know, when I do these, it doesn't hurt so much. These does a little bit. So it's a little bit of
So
weakness.
this hurts?
That hurts.
Brachioradialis.
Sure.
It's not even your bicep. Yeah. Lay down facing up.
After more than 2 decades of treating patients, sometimes it only takes a small hint of movement, a story, or the way the injury happened, and the problem becomes clear to me. Many times patients have been searching for answers for months, sometimes years. And by God's grace and years of experience, I'm often able to recognize what others have missed and help restore movement, strength, and relieve pain.
They'll come in like this. They can either separate out when they subluxate or they rotate in when they subluxate. Yours rotated in. Okay? That's called golfer's elbow as opposed to tennis elbow. You have your permission to adjust this?
Yes.
Okay. Relax the arm. Drop it totally. Relax it. Yep, there we go. Okay. Ready? Pull to you. Please tell me you feel a huge difference there, right? Now I'm not done.
Absolutely.
Relax the arm. I'm going to hold it. Now relax again for me, brother. There we go. When you said fantastic, does that mean I'm on the right spot? Yeah, well, right away I knew exactly what it was when you told me the mechanisms of injury.
Yeah.
Because that's brachioradialis more than the bicep itself. You ready? I'm going to push again.
Okay.
Turn. Pull to you, please. Test it out. Tell me how that feels. Is there anything that you could do to, like, what would cause pain before?
Feeling it naturally. Pressing on it would cause pain.
How's that now?
Man.